we inherit a lot of people who were moved up too quickly from one of these online things that people don't know what they're doing. And what people realize is when you get to the top of that range, I mean, there's nowhere to go. There is a max dose on these medications. And if you move too fast and you have a lot of weight to lose, you're going to desensitize yourself. And then the only thing we can do is pull you off for a couple months and try to get you resensitized. And not everybody does.
This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and I'm here today talking with Ashley Millhiser. Ashley is a naturopath in Arizona. She has the med spa with 2 locations. She originally went to undergrad at UC Davis, got her degree in exercise physiology, and then ended up at the Southwest College of Naturopathic Medicine, graduating in 2018. And she is the owner of Real Results Medical and Aesthetics. And we have done several episodes about weight loss with the GLP-1 agonists. And you can go back and look at those episodes. They're kind of interesting. But now we've had so many people who've lost weight on these drugs and are asking about like what happens long term. How do they maintain it? How do they stay fit? And we're going to talk about, okay, so I lost weight on GLP-1s. What next? So Ashley, thanks so much for coming to talk to us about this today.
Thank you so much for having me. This is a topic I'm super passionate about, so I'm really excited to be here.
So tell me a little bit about how you got into the weight loss biz and how that got started and how long you've been doing it.
Yeah, so I mean, really, we're a full medical, full aesthetics business, and we offer so many things. And weight loss and weight management is really just one component about it. As a naturopathic doctor, I've seen firsthand just how powerful it can be when we provide the body optimal conditions, the basic fundamentals of health, and then sort of get out of the way. And when patients who are, suffering with excess weight gain and comorbid conditions that come along with that shed those pounds, it not only makes my job easier, but I'm also able to help get them off other medications. They have better energy, more
Mm-hmm.
confidence, better sex life, just all around total change, which for me is a win every time. So I've been doing just general naturopathy or a variety of different things within that since 2018. And weight loss has really always, in one way or another, been hand in hand, or, general lifestyle recommendations have come hand in hand with that.
Yeah, I know firsthand that losing the weight, at least for me, has been life-changing. I mean, I just have more energy and I'm able to do more exercise and I'm more fit and like my back pain, I'm a tiny tad older than you. And, I've had back pain for a few years. That went away. So it's pretty amazing once you've gotten that far. We have a lot of patients who are kind of in the middle of their journey, and I'm sure some people who haven't even thought about it. But we're starting to have a lot more people who are just managing this long term, right? Like they lost the weight and now they're looking at one, how to keep it off, how to stay fit, what does it look like long term? So can we talk a little bit about that? I know we're kind of skipping over how you do your practice, but we know there are so many people across the country now who are managing weight loss programs. So so first of all, let's just talk about the drugs themselves. So once you've lost weight on a GLP-1 agonist, do you feel that everybody or most people or a few people need to be on it long term? And what do you tell people about that, and what kind of cadence?
Sure. So, in general, there is no cookie cutter approach to health, right?
Yeah.
Everything is super individual. So, you are going to have some people who will lose weight rapidly, some people who will lose weight slower, some people who have better success, some people who, maybe need it more long term, some people who just genuinely feel better on it more long term, and then others who don't need that. I'm a big
Mhm.
proponent of really trying to only give the body what it needs and not any more than that, right? And
Yeah.
so if people are using these medications and the ease of the situation that it puts them in to create some of those diet and lifestyle changes that maybe they've had a harder time with, and they really maximize those changes, I find that they really don't necessarily need to be on it, long term. There are some situations where I'm seeing people's inflammation and things like that do really well on more long term microdosing. But again, that's going to be so situational. And so oftentimes what happens is we work through the process with patients. They get to kind of their end goal, and we have a bit of a discussion about how they feel, whether they feel ready to kind of make that transition. A lot of times I'm a fan of a wean off instead of just yanking people off, right? These medications have, one, curbed appetite and cravings. And if people have done a really good job of setting up those habits, it is easier to come off. But still, there's going to be that bit of a challenge of, now you've got going from all the support to no support. So sometimes what we do, and again, it's very individual to the person, we have a conversation of maybe going every other week with the medication. They start to kind of flex that muscle of, self-restraint and remembering what that felt like without a week of without the medication. Sometimes people only need to do that for a very short amount of time and they feel really good and confident moving, obviously checking in on all the lifestyle stuff along the way. Sometimes people even want to go, every 3 weeks for a while. Again, it really is individual. And then there are those certain situations where we microdose because it just seems to work best for other areas of the patient's life. Maybe it's helping them with their joint aches and pains by lowering their inflammation load. It just depends on what other things they have going on. What does their disease state look like?
So when you say backing to every other and then every third week, are you talking about keeping the same therapeutic dose that they were on
Yeah,
and
and so
then
I think people
decreasing the
have,
cadence?
yeah, for me, I have found in my practice with patients that that tends to work a little bit better than lowering the dose each week because,
Hmm.
part of what these medications are doing, of course, is slowing the rate that food moves through the stomach. And so you're feeling fuller longer. And if you just lower the dose, if you're too low, then you're not getting the effect anyway. And so sometimes
Yeah.
what I've found is it's better to keep that dose the same so you have a week of still having that support, and then you just go longer and longer in between so that you get better and better of like, oh, wait, I'm starting to feel hunger again. I understand what I have to kind of do here. I've seen that
Right.
personally work better with patients than, lowering the dose each and every week.
Yeah, and I would definitely agree with that. I think for our audience who may not know, everyone tends to have a different dose that works well for them. So, we start people on a low dose and we increase it over time, and the dose they get to that works best for them where their appetite is appropriately lessened and they're eating the right amount of food, enough nutritious food to keep them energetic and going. What they ended up on is very different, and I have found that it doesn't relate to how big they are, and it doesn't relate to how old they are or anything. It's just some people, like
So
with
individual.
it's very individual. So one person will be on a dose that's twice that of what the other person's on, but they have the same effect. So
Yes.
keeping that same therapeutic dose, but decreasing the frequency, that's what we've done that as well. And it seems to be somewhere about, maybe every 3 weeks or 4 weeks where people can maintain and not gain weight. And that seems to work out long term if they're going to be on a dose long term. People have asked me about, should I cut the dose in half? And we haven't really tried that. I don't know if you've tried that, but I don't think that is going to be as effective as decreasing the cadence of the shots? Yeah.
We did
Taking shots.
try that kind of earlier on with working with these medications, as I was kind of figuring out like what is going to be the best system for my patients. And just like you mentioned, right? So if you have like this exact amount of medication that you found that is their sweet spot and you just lower their weekly dose already, they're going to be, mentioning, hey, I just never had that appetite suppression. And our goal is to get them kind of slowly weaned off of it in a way that is supportive to them and not too
Hmm.
quick. And so if you're lowering it every single week, I just see them struggle. Early on when I was doing that, I did see them struggle more, have more issues with kind of rebounding or not controlling those, cravings or whatever it might be, then kind of that every other week. Let's do that for a while. Okay, you feel good with that. Okay, let's go
Hmm.
every few weeks, and just kind of going from there.
Do you have any patients who have weaned off of it entirely and have maintained their weight loss?
Yeah, I have actually a ton of patients. Again, a lot of my patients don't want to be on things any longer than they have to.
Hmm.
You do get some of those patients who, like I mentioned, with the inflammatory side of things, where they're just getting really good benefits long term, or they're really just nervous. Like, hey, listen, I've made such huge strides here and I'm just not ready to 100% part with this. But I would say a grand majority of my patients actually, if they're doing the appropriate things, have lost the weight, come off, maintained the appropriate lifestyle stuff, and done really well after. And we're really, really big about, making sure we're optimizing the person as a whole so that they
Hmm.
are wholly supported in their weight loss journey, like looking at their labs, how's your hormones, how's your thyroid, all of these things are going to play into it so that you are really set up to be functioning optimally when you come off of it, right? And I've seen people do really great and not rebound back, lost 50, 100, more pounds on it, and come off and still maintained, a grand majority of that weight loss.
So, what does all of the support look like? So, let's talk about diet and nutrition a little bit. How do you counsel your patients on diet and nutrition long term?
Yeah, so of course, the first and foremost thing is getting people eating whole foods, right? So many people got into the position that they were by the convenience foods, not having, there's a lot of misinformation out there about what a healthy diet looks like and, how much to eat and this and this and that. And should I have 6 meals a day and 3 meals a day, intermittent fasting? And so, the
Right.
first and foremost thing is, are you eating the right types of things? Are you
Yeah.
eating whole foods or are you eating processed foods, and kind of removing those things from the diet? We're really big about convenience and making health convenient for people, because one of the reasons that people complain about having issues with weight loss is either time or, they're tired. And so we set up people up with, good quality local meal delivery service companies that help provide them good nutrition so that they have healthy meals on the go. We talk to them a lot about protein, because one of the biggest things that you have to watch for, of course, during the process of any weight loss journey, but especially with these medications, if they're not being done correctly, is muscle wasting. So we typically try to recommend for our patients about a gram of protein per pound of ideal body weight. Now, sometimes that can be really hard to achieve, especially
That's
one, if you're
high.
not used to focusing on protein, and two, if you're taking these medications that are really curbing your appetite. And so I always tell patients, listen, if you are focused on that and shooting for that and you're getting close to that, you're not going to have room for all of that junk and that extra stuff. And you're going to be feeding your body with the amino acids necessary to help, build and maintain that muscle in this process.
Yeah, and I would say a gram, I mean, that's hard to do, even just for, without being on those drugs. I've heard formulas anywhere like usually point 0.7, grams per pound of body weight or whatever.
Do ideal body weight. So, for
Yeah.
example, if you
Okay.
come
Okay.
in
So
and
not what their
you're
actual body
140
weight is.
pounds, yeah, and you want to be,
Yeah.
110, or I'm just throwing numbers out there,
Yeah.
then your goal is to shoot for 110 grams of protein, right?
Yeah.
So, again, I set people up in the beginning saying, look, you might not get there
We're going to
right
make
away. right?
Right.
But small strides will make it there. And if that's your intention, then you're just going to be so much more successful in, getting closer to that.
Yeah. Yeah. I mean, I would say that's ideal. I mean, I think to prevent wasting for like a 150-pound person, which is in medicine, we often talk about the average 150-pound person. I say person, but honestly, it was always men back in med school. But yeah, so it would be at least 60 to 80 grams just to prevent muscle wasting. But
Mhm.
that's not, that's just like minimum to not start wasting away. The reason that protein is so important is that we take our energy from our muscles. When we run out of glucose in the bloodstream and the glycogen stores in our liver are used up, the body starts breaking down the muscles to keep going. And so if you don't have enough glycogen stores and glucose in your bloodstream and you're not maintaining your protein, then you're going to take your muscles out. So really important to have enough protein, really important to do strength training, ideally twice a week. So maybe we could talk about exercise as well. What do you counsel your patients for exercise?
Yeah, so I find a lot of patients when they are wanting to lose weight, they think of, running, walking, cardiovascular related activity, which is great for the cardiovascular system and super important, but those are very catabolic, meaning like they break down tissue type activities. And so again, there's a time and a place for that, but really making sure that we're building in some strength training. I tell people definitely, a lot of it is meeting them where they're at, right? Some people might be starting from zero. And so I'm not going to say, get out there and do 3, 4 times a week right away. But, maybe, okay, how can you commit to once a week, to start? And then we work up from
Mm-hmm.
there, but really focusing on muscle building activity so that we can preserve as much muscle as possible. And then going back to that whole convenience thing, we're really big about setting people up with a team of people to help them feel supported. So we network with a lot of personal trainers in the area who do both in-person and online programs. So I'm always offering that to patients because, a lot of people, they just don't have the motivation to get there. And I find that when someone's holding them accountable, they're so much more likely to show up. I'm always like, you showed up today for this appointment because
Yeah.
you were on my schedule. You weren't leaving it to your own devices. So, how do we do that in the other areas of your life to help you better achieve your goals?
Yeah, I think that's really great advice. And if you do love to do cardio, one thing to keep in mind is that, as I said, like once you run out of the glycogen stores in your liver to keep going, you start breaking down muscle. And that happens somewhere around 40, 45 minutes. So when you do cardio for more than that amount of time, you're actually breaking down muscle, unless you're eating something while you go, right? Unless you're eating that goo stuff or whatever, you're going to break down muscle to finish out that hour on that Peloton class or whatever it is you're doing. So ideally, if you're going to do cardio, frequently, right? Keep it to, 30 to 40 minutes if you're going to do that like every day or whatever, if that's your favorite thing to do. Yeah. In order to not lose your muscle. I always think also doing a set of sprints. I always say once a week because it's easier to remember that way. Once every 7 to 10 days is like ideal, where you like go all out just for, a short period of time, like a high intensity interval thing.
Yes.
But it doesn't have to be like a whole hour. It could be, 15 minutes of that is fantastic. But that
Yeah,
is
I was
really
going to
great
say
too.
that hit training in short bursts is actually my preference. That 12 to 15 mark, I think, is a great sweet spot for people to not overly burn themselves out,
Yeah.
really feel good afterwards. And, in some situations, you're actually like maybe burning even more fat doing that than, jumping on these long-term steady state cardios. Where
Hmm.
just like you said, we're actually switching more into burning up muscle than fat. And so you're almost kind of going in the wrong direction of your goals there.
Yeah, exactly. I think it's very hard to get people to conform their exercise schedule to like what I think as their doctor and their to recommend. But my ideal schedule is right. So strength training twice a week, although like separated enough time so your muscles can repair after you strength train. Because ideally you're pushing to your maximum, right? So you're doing to failure, right?
Mhm.
And so then your muscle has to recover, but twice a week. And then around once a week, do that sprints, that high intensity interval training. And then the other days, do 30 to 40 minutes of low intensity, whatever it is. That's kind of what I counsel people, but not that I think that people necessarily go and do that once I tell people that, like maybe some do.
Yeah.
I do think that the hardest thing is changing your habits. But I also think that with these medications, when people are really, their bodies are changing and it feels so great and semi miraculous, really like, oh my God, like I can do this. I couldn't do that before. I feel like it's the absolute best time to change your habits because your body's changing and your mentality is changing and your ability to imagine a different life, a different daily routine, a different norm is more, I think it's more available because these drugs really help change your mindset, you know? I
100%.
yeah. People will say that their food chatter goes away, but
Hmm.
I think a lot of the preoccupation of your habits, the things I want to do this, I want to do that, I want to do that tends to quiet. And I don't know if you've noticed that or if people have little less anxiety. I know for sure they're drinking less, they're less compelled to do the things, whatever vices they really love to do, they're less compelled to do them, and it's a really great time to change your lifestyle. Have you noticed that yeah,
Absolutely. Yeah. I mean, it definitely does make this, you have the whole spectrum of people, and you do have the people who come in and they are looking for the quick fix. And we're having the constant conversations about how
right.
important it is to make those changes. And, sometimes they just never do. And it's really kind of a bummer because they have so much opportunity here. But, there are really a good majority of people who are doing this to make a huge change in their life. And they're seeing that it's easier, and it's exciting to be a part of that journey with them and to watch them just, kind of blossom in those ways.
Yeah. So besides the kind of lifestyle changes, I think if I recall, we both have the same muscle building device, right? The Emsculpt Neo. Yeah. So have you used that in either at the same time as the weight loss program or once people have lost weight to build muscle up? How does that fit into your recommendations?
Yeah, so we use Emsculpt Neo all the time, obviously in weight loss and in rehabilitation in all kinds of ways. It's such a cool device for people who don't really know about it. It uses two different types of, technology at the same time, radio frequency heat to help rupture fat cells. So you do get a little bit of a fat loss component. It's really great when you treat the abdomen with this. You can also make a difference on the visceral fat too, which is, really the harder to treat fat that's padding the organs. And then at the same time, it's also using a concentrated MRI like stimulation technology called HiFem that will help you contract up to 100% of the muscle fibers we're targeting. And we do use this all the time with weight loss to help people get, better, faster results, help them build muscle either during or after, right? Everybody talks about, watch out for the Ozempic booty, right? Or kind of, muscle wasting too much. Now you get the flat pancake butt. So we use it a lot, both in the abdomen, on the glutes to help people really shape and tone their body. Sometimes we get patients who have gained weight because maybe they got injured and they can't get in the gym in the same way. And this device can be really helpful at helping get that muscle building action going when maybe there are some limitations there physically as well.
Yeah, we have found it to be super helpful in all those ways as well. People who are rehabbing after injury, they can't quite do the kinds of exercises because of their joint pain, or maybe they need a knee replacement and they injured their patella and they can't really do the quads
Yeah.
exercises anyway, we found that Emsculpt Neo actually helps people rehab when they can't do the PT. And then, yeah, for people who are building muscle back up after losing weight or during, it helps at the same time. It's an interesting thing to do separately because when you do it at the same time, especially with the GLP-1s and you're losing weight on that, it is very nice to see how that affects your fat without
Hmm.
combining it because then you don't know what came from what sometimes.
Right.
But I definitely think that it's super helpful to like build back that strength, especially towards the end of the treatment, maybe.
Yeah,
We tend to
absolutely.
time it closer towards the end. Yeah. And for people at home, like if you've never heard of this device, I think most of our listeners probably heard of it, but you can actually do your abdomen, your buttocks, your thighs, your calves, and even your arms with this device. And it builds muscle and kills fat. And you can turn the killing fat part off. So if you're doing your butt and you don't want to kill the fat in your butt, then you can turn that part off for the buttocks treatment. Yeah. So have you seen what are the major pitfalls that you've seen as people have gone through the treatment and then after maintaining it? Have you had any, things where, oh, shouldn't have done that or
Yeah, and so sometimes the things that I'm seeing wrong, maybe they're not even happening within my practice. Maybe we've inherited patients, from other places down the line. But one of them is definitely not doing appropriate titration. People thinking, moving
Mhm.
too quickly,
Too quickly
muscle
is, yeah.
wasting. Yeah, and people need to understand that your muscle is one of the main things that sets your metabolism. So if you're not paying attention to that or your provider is not paying attention to that, they are doing an extreme disservice. We measure people on a machine called the InBody, which measures like your muscle mass, your water weight, your body fat distribution of all of those things so that we can be really cognizant of where that weight is coming from. And I know
Mhm.
it took off like a craze, this weight loss thing, which is amazing. But then there's people just doing it online.
Yeah.
They're just going based off a number on a scale. And what I've seen in practice is people will come in and be a little disheartened because their scale didn't move a lot. But when we get them on the InBody, it's like, wait, we saw a really great result here. You might not have lost weight per se, but you gained muscle and lost fat, which is more
Mhm.
important. So, kind of the long and the short of that is moving too quickly on it and not focusing on fat loss as opposed to weight loss is definitely one of them. Another thing, I kind of mentioned early on or earlier is not taking advantage of this window of ease and opportunity that you have to make these changes at a time when it's a little bit easier for you, right? I mean, we're really trying to create long-term healthy habits and a total lifestyle shift here. And if people are just using this as a quick fix and they're getting excited about the weight loss and they're not making the changes, you absolutely can rebound on that weight loss when you come off of it if you have changed nothing about your life.
Mhm.
So those are probably some of the bigger things that I've seen. There's a lot of things that can happen and go wrong with muscle wasting. And so I just can't stress enough that how important it is to
Yeah.
really be watching that. And more is not better with these medications. Losing weight faster is not the answer, even though we all want to lose it like yesterday. Patience really wins the race.
Yeah, wholeheartedly agree with that. Definitely the things I've seen and honestly the ERs I've seen are people who are brought up on their dose way too fast.
Hmm.
And they end up, especially on semaglutide, people end up with nausea and vomiting and sometimes go to the ER because their dose is just it just went up way too fast. And having some patience because it will work, it will come off, but having some patience and doing it in a really safe, healthy way. I think also having a real clinician helping you through that journey is so important. We just saw, I don't know if you watched the Super Bowl. I'm not a big football person, but I did watch the Super Bowl and mostly for the ads. But there were two ads for online weight loss programs. And I've had a couple patients who've shown me what those apps look like. And you
Hmm.
really get no helper advice from a human. And I really I just think that that's really hard because each week, you may have some side effects, you may not. You may lose weight too quickly or too slowly. You may need nutrition advice. You may need to, have support again, like with hormones and other things. And it's so important to have a clinician managing that and helping you through that. I actually had a patient recently who said, "You know what? This online thing is much cheaper, so I'm not actually coming back to you guys anymore. But can I still come to you to get all the advice?" And I'm
Yeah.
like, "Wait. So you're gonna pay someone else, but they're not helping you? So you want to?" It was just really funny. I was like, "Okay," and that's the problem with those is like they don't really help you,
I always tell patients, like in general, in anything we do, hormones, whatever it may be, we might not be the cheapest guy in the block, but we're the best bang for your buck because we're going to
right?
get healthy results that last. We're looking at your entire system. We're trying to optimize you as an entire individual. And yeah, going with the cheapest option. I mean, I've just seen so many things go wrong with that. In addition to all of what you mentioned with the side effects and the muscle wasting with titrating too quickly, we inherit a lot of people who were moved up too quickly from one of these online things that people don't know what they're doing. And what people realize is when you get to the top of that range, I mean, there's nowhere to go. There is a max dose on these medications. And if you move too fast and you have a lot of weight to lose, you're going to desensitize yourself. And then the only thing we can do is pull you off for a couple months and try to get you resensitized. And not everybody does. I mean, that's the unfortunate thing. I've
Mm,
seen people get there, still have another 20, 30, 40 pounds to lose. And they've really kind of run out of options when it comes to these medications and what they can do for them. So it's just really important that people are just not going for the cheapest, quickest thing, because it's going to cost you more in the long run.
that's really interesting. So I actually have yet to have somebody who is sensitized to it and it didn't work. But you're
Yeah.
seeing that. That's kind of
Yeah, we've
interesting.
had, I mean, again, not coming from our clinic because we don't do
Hmm.
things in that way, but I've definitely inherited several patients where they're coming in on, 15 milligrams of Manjaro or Tirzepatide, all these things, and they're not seeing results anymore, and they still have another, 40 pounds to go, and they just,
Interesting.
don't know what to do. And so we have to pull them off and try to kind of resensitize them and work on other things, and then come back to it. And sometimes it does work. And then sometimes, they just don't gain it back the way that they had it in the first time. They just don't have as good a luck as if they would have just done it correctly from the start.
Hmm. Hmm. Interesting. Have you seen your own patients who are diabetic then become no longer diabetic, or people who are pre-diabetic and no longer? Have you seen their hemoglobin A1Cs just normalize completely? Like what's been your experience there?
Yeah, this has honestly been one of my favorite medications for, diabetics, even when they're coming in on other things and we're having that conversation, let's see what your insurance can cover, whatever it may be. I have just not seen very many medications lower an A1C in the same way that I
Hmm.
have these medications. And not even just that, but let's talk about cholesterol as well, which can also
Hmm.
be heavily driven, especially triglycerides, by blood sugar. I've been able to get patients off of cholesterol medications as well. And when, nothing's ever worked for them, even their cholesterol
Hmm.
medication wasn't working as well for them, or rebalancing hormones like conditions like PCOS or infertility. And so many positive things by, lowering a blood sugar and losing
Hmm.
some belly fat, that what it can do for you overall.
Yeah, absolutely. We've had patients who weren't getting a period for a long time lose weight and start getting their period again, and they're basically doing this so they can have a baby, which is amazing. We've seen people whose blood pressure has normalized
Hmm.
after being elevated, just moderate elevation, go back down to completely normal. It's been just life changing for so many people.
Yeah.
So I wanted to get from you, if you're speaking to people who might be consumers or potential people who might be interested in losing weight with these drugs, what one or two pieces of advice would you give to them as they look for a place to go or as they keep progressing on their weight loss journey?
Yeah, so it's nothing new that I haven't already been kind of hitting home, but just to kind of like revisit it all, for sure, make sure you are working with a provider who is focusing on fat loss and not weight loss. They need to be measuring some kind of a metric other than just your weight, because weight loss is not linear, especially when we
Hmm.
are exercising, trying to build muscle and all of those things. The best way for you to get long lasting results is to maintain as much muscle in the process and have a provider who really understands the ins and outs of these medications and what it means to optimize you overall, right? Hormones and everything. So you're really set up for success. And the second thing is, more is not better. Like I said before, everyone wants to lose weight fast, but fast results are not sustainable and they can be super damaging long term. So have some patience with it. And, it kind of ties into the provider's knowledge. Just because your progress slowed 1, 2 pounds this month over last month, it doesn't necessarily mean that it's time for you to move up on that medication. So,
Well, that's great advice. And Ashley, thank you so much for being on the podcast today. So it's Dr. Ashley Millhiser, and her practice is called Real Results Medical and Aesthetics in Tempe and Scottsdale, Arizona. And we'll have links to her practice and how to reach her in the show notes. So Ashley, thank you so much for talking with me today.
Yes, thank you so much for having me. I always love sharing knowledge with co-providers who have that same mindset, that same passion. So I really appreciate being here and sharing some good knowledge.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website MedSpaMayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.